this side Dr. Kanchan, Associate Professor in Jyoti Vidyapeeth Physiotherapy Department. Today I am presenting one of the topic, that is radio diagnosis in physiotherapy, which is playing a very important role in diagnosing, in finding the actual identification of the disease or the condition from which the patient is suffering. Without diagnosis or without assessment, without identification, we are not be able to analyze the exact situation, exact condition of the patient, so that we can plan a tailored program for the patient suffering. So with the PPT, with the presentation, we will have some of the facts regarding radio diagnosis, and I hope this will be very beneficial for all of you. So let's come with this. Now, first of all, when we are going for the radio diagnosis physiotherapy, the question comes, what is radio diagnosis? The question comes, what is radio diagnosis? So radio diagnosis, क्या होता है radio diagnosis? When we are working with the radio diagnosis, this term splits into two divisions, radio plus diagnosis. It means the diagnosis from the imaging techniques. So that whole the term radio diagnosis tells about the imaging techniques which we are using to diagnose the patient suffering or the condition. So when we are talking about this, so that is the main problem. So this is radio diagnosis is an essential tool for physical therapists. By interpreting images, therapists can accurately diagnose musculoskeletal condition and make a treatment protocol. So radio diagnosis, as we have seen here, a very small definition or introductory for you all, that is, it is one of the tool which we are using to analyze or to find out or to identify the exact diagnosis toward the musculoskeletal condition. So the introductory part, when we come to radio diagnosis, as already I have told that radio diagnosis is divided into two parts. That is what we can say. The first one is the imaging technique, and second one is the diagnosis. It means that we are doing diagnosis throughout the imaging techniques. So now the main part in radio diagnosis is how we understand the images. Now, radio diagnosis uses imaging technologies to visualize the internal structures. So, whenever we are understanding the images, basically we are getting the concept of the internal structures from which we are visualizing, we are identifying the main internal aspect of that particular structure. So the second thing is the medical interpretation. In the medical interpretation, we are identifying some of type of abnormalities which is helpful for guiding us about the treatment protocol, or when we are making a tailored program for the patient or the patient condition, it is most important for the scenario where we are getting success toward our treatment. So come to the next part, that is the diagnosis and the treatment. As I have said in the very early stage, that is most important in the radio diagnosis, that we have to understand the image. what is the image, what is the structures, what is about, and what is the differences between the normal and the abnormal structures. So secondly, we have to go for the medical interpretation. Either there is having any type of abnormality, either there is having any type of alteration in the structures or the images. We have to identify that and we have to interpret. If there will be having any type of abnormality, we have to take out that, and we have to find out that, and after that we have to use that for the interpretation, and which is very much helpful for getting a perfect treatment protocol. So the next one is the diagnosis and the treatment. So in the diagnosis and the treatment part, in this context, we can say the radiographic finding is most important toward to diagnose the condition or to make the treatment of that condition. So radiographic finding help the therapist to determine the extent of injury, to identifying the underlying cause, what is the factor behind that, where that abnormality is present, and it at the last it is helpful for developing a planned protocol or a tailored program for the treatment of the patient condition. So with this, we have the introductory part of the radio diagnosis. Now the another thing is the imaging modalities in the physical therapy. So for a physiotherapist, we have vast number of conditions which we are treating. So about that, when we are talking for the radiographic imaging techniques, so in that let's have different type of radiographic modalities which we are using to check out the abnormalities, or to identifying, or to understand the image as well, to interpret that particular medical condition or by the image, and afterward we can make the diagnosis and the finding, or we can make a particular protocol of treatment. So these are various type of modalities which we are using in the radiographic imaging technique. The first one is the radiography, that is very simplest and the most commonest one which is to be used in the present era by the physiotherapist to understand the image, to visualize the internal structures, as well as to identify if there will be having any type of abnormality or the alteration. So radiographic x-ray, why it is too much common, it is too much common, it is very, as it is very, we can say easily affordable by everyone, and it is the film which we are getting as compared to CT and MRI. We can get this in a few period of time, as it provides a 2D image. Basically the differentiation between the further different radiologic images technique or the modalities as compared with the X-ray. The X-ray provides the 2D image of the bones, joints, as well it in the form of alteration, it reveals the fractures, dislocations, and many type of inflammatory condition, that is arthritis. So again, if I say in the conclusion part of the radiography, the first modality we have discussed, that is the X-ray. Okay, so when we are talking for the X-ray, this is what it is providing a 2D image through which we are capable to identify if there will be having any type of injury, or sometime we are having any type of pathology regarding with any type of infection or the inflammatory condition. Injury like dislocation, sometime fracture, and sometime displacement also we can see by the X-ray. So the second modality, the radiographic imaging, we can see that is the magnetic resonance imaging, MRI, which offers a vast number of cleared pictures of the soft tissues. So through the MRI or the magnetic resonance imaging technique or the modality, we are capable to seek out or to visualize a clear, defined picture or image of soft tissues, like we have the muscles, we have the tendons, ligaments, and that will be useful to diagnose if there will be having any type of tear or the inflammatory condition. So this is the second imaging modality what we are using in the diagnosis or to identify if there will be having any type of alteration or the condition to make a tailored program for the patient condition or the status. So now the another thing is the ultrasound. Ultrasound is also one of the like a technique, the radiological imaging modality or the tool which we are using to diagnose some of the alteration or sometime the actual condition of the image, which is through by the use of sound waves, and this is usually helpful in examining the muscles, the tendons, joints, and sometimes detecting the fluid also, which builds up some type of inflammatory or inflammation, infectious condition. So these are the three different type of modalities in the physical therapy under radiography which we are using to diagnose the patient condition. And by this again I'm saying this is helpful for making a plan protocol for having a great success in the treatment protocol. With this, the next slide we have the radiographic interpretation for physical therapists. As we have said in the earliest second slide, in the previous slide, we have seen there are three component which we have to focus. That will be the first one is the understanding of the images or the understanding of radiographic techniques or the images or the pictures. The second one is the medical interpretation. That is what the medical interpretation as the physiotherapist or the physical therapist use. The first one is the image analysis. Basically what happens by this, the physiotherapist or the physical therapist analyze or studies or check out the image of if there is having any type of image of fracture, is there is having any type of sign of dislocation or having any type of other alteration or the abnormality. With this, the second thing, the bone integrity. In this, what we are seeking, the bone integrity. In the bone integrity, what we are seeking, basically the alignment of the bone. Means the alignment, as we are examining the alignment and density of bone, by which we are checking if there is any break, deformity, and sometime there will be having any type of structural alteration in the bones. So these are the things what we are doing in the bone integrity part, and afterward when we are proceeding to the roadmap of this interpretation steps, we are going for the joint space. In the joint space, what happened, we are assessing the space between the bones, which sometime we are seeking the narrowing, sometime we are seeking the widening, and these all the condition basically shows the any type of degeneration or inflammatory condition. So with this roadmap, we are going at the last part of the component, that is the soft tissues. Basically, at the last, we can also seek out sometime the observance of soft tissues like muscle, tendon, and by the visualization of that soft tissues, we are having sometime the finding of swelling, tears, or any type of changes or the variations in the appearance of that particular structure. So this is what our medical interpretation, how the physiotherapist is working with, and how a physiotherapist performs the medical interpretation through the radiographic modalities or the techniques. So with this, we are proceeding to the next slide, that is what is the role of radiographics or radiograph in musculoskeletal assessment. So this is also very much important thing for the physiotherapist or the practitioner, that in by the radiograph we can have a proper diagnosis, we can have a treatment planning, we have the progressive monitoring of the patient condition. The first one, as we can say, it's a very crucial role which confirms they'll be having some type of presence of any severity level or any type of like accurate diagnosis. Treatment planning, if we are seeking to, by the treatment planning we are having a tailored protocol which is helpful for the patient recoverance, and the progress monitoring where we are seeking many time when we are giving the treatment, then we are seeking how much that is regained, how much that is recovered. So we are seeking, we are evaluating the changes, the variations of the bony alignment, joint spaces and soft tissue structures. So with the next slide we are having the radiation safety, what we can take, the minimization of the exposure, proper technique we should know, and the patient education before before as we are going for the patient diagnosis. First of all we have to ask the patient, use a shield to protect the patient, and then we should have the proper technique. Afterward we have to give the proper patient education. And this is the case study, what we can see, we can analyze here the shoulder pain, knee pain, back pain. These are the case studies you can see in the image from here like this. Okay, and in the last slide the integrating radio diagnosis into physiotherapy practice, like by the three components, the teamwork, and the another one is the patient education, then evidence-based practices. So teamwork, collaborating radiologists and other healthcare professionals toward the effectiveness of the treatment. Patient education, basically it explains the clear understanding toward the engagement and the adherence of the treatment protocol. Again, the evidence-based practice, we are able to make or this radiographic imaging guide us to guide to treatment decisions, and we have the assurance toward the intervention protocol. So thank you.